Assessing mental status is a fundamental topic for nursing practice, as mental health is just as important as physical health. A well-conducted mental status assessment allows us to understand a patient's cognitive, emotional, and psychological well-being. It also helps us detect early signs of mental health disorders and provide timely intervention. Mental health is not just the absence of illness. It is a state of well-being where individuals can cope with stress, work productively, and contribute to society. According to the World Health Organization, mental health is essential for overall well-being. On the other hand, mental disorders are conditions that cause significant distress or impairment in thinking, mood, or behavior. This can range from anxiety and depression to more severe conditions such as schizophrenia and bipolar disorders. As nurses, understanding these disorders helps us assess patients holistically because mental health affects physical health and vice versa. Now let's talk about our role as nurses. Nurses are often the first healthcare professionals to notice changes in a patient's mental status. We assess patients for signs of emotional distress, cognitive impairment, or behavioral changes. Our responsibilities include conducting mental status assessments, including evaluating mood, cognition, and behavior. Identifying risk factors such as stress, trauma, or family history of mental illness. Providing a safe environment and emotional support for patients in distress. And referring patients for further psychiatric evaluation when necessary. We must also be skilled in therapeutic communication, such as listening actively and responding with empathy to build trust with our patients. Many factors contribute to a person's mental health. These include biological factors. These are the genetics, neurotransmitter imbalances, and brain injuries that can predispose individuals to mental disorders. Psychological factors such as trauma, coping skills, and self-esteem play a role in how people manage stress. Social and environmental factors. These include relationships, socioeconomic status, cultural background, and access to health care all impact mental health. Medical and physiological factors can also impact mental health. Many chronic illnesses have been linked to mental health disorders, particularly depression and anxiety. Chronic illnesses such as diabetes and heart disease can significantly contribute to depression. Managing these conditions often involves lifestyle changes, ongoing medications, and sometimes physical limitations, all of which can take a toll on mental well-being. For example, a patient with uncontrolled diabetes may feel frustrated about dietary restrictions or experience emotional distress from fluctuating blood sugar levels. Similarly, individuals with heart disease may develop anxiety about their health and future. Medication side effects can also impact a person's mental state. Many commonly prescribed drugs, such as steroids, antihypertensives, and even some antibiotics, can cause mood swings, confusion, or cognitive impairments. Patients who take multiple medications, especially older adults, may experience these side effects without realizing they are medication related. As nurses, it's crucial that we assess whether a patient's mental health symptoms are due to an underlying medical condition or a medication reaction. Understanding these factors allows us to develop a patient-centered approach when conducting assessments and planning interventions. Let's briefly discuss some common mental disorders. We have mood disorders. These include depression and bipolar disorder, which affect emotional stability and daily functioning. Anxiety disorders, such as generalized anxiety disorders, panic attacks, and phobias, which can be debilitating. Psychotic disorders, such as schizophrenia, as characterized by hallucinations, delusions, and impaired thinking. Personality disorders, which include conditions like borderline personality disorder that affect how individuals relate to others. Cognitive disorders. Dementia and Alzheimer's disease lead to progressive memory loss and cognitive decline. Recognizing early signs and symptoms of these disorders helps nurses provide appropriate interventions and support. Substance abuse is closely linked to mental health. Many individuals use substances such as alcohol, nicotine, and illicit drugs as a way to cope with stress, anxiety, or depression. However, substance abuse can lead to dependence, withdrawal symptoms, and worsening mental health conditions. As nurses, we screen patients using tools for alcohol dependence and to assess substance-related risks. It is important to approach this topic with sensitivity, offering support rather than judgment. Assessing mental status is a crucial component of health assessment. Mental health and mental disorders affect overall well-being, and nurses play a critical role in identifying risk factors, conducting assessments, and providing compassionate care. Understanding factors that influence mental health, recognizing signs of common mental disorders, and addressing substance abuse help us support our patients holistically. Remember, mental health matters. As future nurses, you will be advocates for your patients' well-being, both physically and mentally.